Section number 30 of Gray's Anatomy, Part 3. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Marianne Coleman Hipkins. The Popliteal Fossa, the Popliteal Artery. 6b. The Popliteal Fossa. Boundaries. The popliteal fossa, or space, is a lozenge-shaped space at the back of the knee joint. Laterally, it is bounded by the biceps femoris above and by the plantaris and the lateral head of the gastrocnemius below. Medially, it is limited by the semitendinosus and semimembranosus above, and by the medial head of the gastrocnemius below. The floor is formed by the popliteal surface of the femur, the oblique popliteal ligament of the knee joint, the upper end of the tibia, and the fascia covering the popliteus. The fossa is covered in by the fascia lata. Contents. The popliteal fossa contains the popliteal vessels, the tibial and the common peroneal nerves, the termination of the small saphenous vein, the lower part of the posterior femoral cutaneous nerve, the articular branch from the obturator nerve, a few small lymph glands, and a considerable quantity of fat. The tibial nerve descends through the middle of the fossa, lying under the deep fascia, and crossing the vessels posteriorly from the lateral to the medial side. The common peroneal nerve descends on the lateral side of the upper part of the fossa, close to the tendon of the biceps femoris. On the floor of the fossa are the popliteal vessels, the vein being superficial to the artery and united to it by dense areolar tissue. The vein is a thick-walled vessel, and lies at first lateral to the artery, and then crosses it posteriorly to gain its medial side below. Sometimes it is double, the artery lying between the two veins, which are usually connected by short transverse branches. The articular branch from the obturator nerve descends upon the artery to the knee joint. The popliteal lymph glands, 6 or 7 in number, are embedded in the fat. One lies beneath the popliteal fascia, near the termination of the external saphenous vein, another between the popliteal artery and the back of the knee joint, while the others are placed at the sides of the popliteal vessel. Arising from the artery and passing off from it at right angles are its genicular branches. 6c. The popliteal artery. A. Poplitea. The popliteal artery is the continuation of the femoral and crosses through the popliteal fossa. It extends from the opening in the abductor magnus at the junction of the middle and lower thirds of the thigh, downward and lateralward, to the intercondyloid fossa of the femur, and then vertically downward to the lower border of the popliteus, where it divides into anterior and posterior tibial arteries. Relations. In front of the artery from above downward are the popliteal surface of the femur, which is separated from the vessel by some fat, the back of the knee joint, and the fascia covering the popliteus. Behind, it is overlapped by the semimembranosus above, and is covered by the gastrocnemius and plantaris below. In the middle part of its course, the artery is separated from the integument and fasciae by a quantity of fat, and is crossed from the lateral to the medial side by the tibial nerve and the popliteal vein, the vein being between the nerve and the artery and closely adherent to the latter. On its lateral side above are the biceps femoris, the tibial nerve, the popliteal vein, and the lateral condyle of the femur. Below, the plantaris and the lateral head of the gastrocnemius. On its medial side above are the semimembranosus and the medial condyle of the femur. Below the tibial nerve, the popliteal vein, and the medial head of the gastrocnemius. The relations of the popliteal lymph glands to the artery are described above. Peculiarities in point of division. Occasionally, the popliteal artery divides into its terminal branches, opposite the knee joint. The anterior tibial, under these circumstances, usually passes in front of the popliteus. Unusual branches. The artery sometimes divides into the anterior tibial and peroneal, the posterior tibial being wanting or very small. Occasionally it divides into 3 branches, the anterior and posterior tibial and peroneal. Branches. The branches of the popliteal artery are muscular, superior, sural; cutaneous, medial superior genicular; lateral superior genicular; middle genicular, medial inferior genicular, lateral inferior genicular. The superior muscular branches, 2 or 3 in number, arise from the upper part of the artery and are distributed to the lower parts of the adductor magnus and hamstring muscles, anastomosing with the terminal part of the profunda femoris. The sural arteries, AA suralis, inferior muscular arteries, are 2 large branches which are distributed to the gastrocnemius, soleus, and plantaris. They arise from the popliteal artery opposite the knee joint. The cutaneous branches arise either from the popliteal artery or from some of its branches. They descend between the 2 heads of the gastrocnemius, and piercing the deep fascia, are distributed to the skin of the back of the leg. One branch usually accompanies the small saphenous vein. The superior genicular arteries, AA genu superioris, superior articular arteries, 2 in number, arise one on either side of the popliteal and wind round the femur immediately above its condyles to the front of the knee joint. The medial superior genicular runs in front of the semimembranosus and semitendinosus, above the medial head of the gastrocnemius, and passes beneath the tendon of the adductor magnus. It divides into 2 branches, one of which supplies the vastus medialis, anastomosing with the highest genicular and medial inferior genicular arteries. The other ramifies close to the surface of the femur, supplying it and the knee joint, and anastomosing with the lateral superior genicular artery. The medial superior genicular artery is frequently of small size, a condition which is associated with an increase in the size of the highest genicular. The lateral superior genicular passes above the lateral condyle of the femur, beneath the tendon of the biceps femoris, and divides into a superficial and a deep branch. The superficial branch supplies the vastus lateralis, and anastomoses with the descending branch of the lateral femoral circumflex and the lateral inferior genicular arteries. The deep branch supplies the lower part of the femur and knee joint, and forms an anastomotic arch across the front of the bone, with the highest genicular and the medial inferior genicular arteries. The middle genicular artery, A genu media, azygos articular artery, is a small branch arising opposite the back of the knee joint. It pierces the oblique popliteal ligament and supplies the ligaments and synovial membrane in the interior of the articulation. The inferior genicular arteries, AA genu inferioris, inferior articular arteries, 2 in number, arise from the popliteal beneath the gastrocnemius. The medial inferior genicular first descends along the upper margins of the popliteus, to which it gives branches. It then passes below the medial condyle of the tibia, beneath the tibial collateral ligament, at the anterior border of which it ascends to the front and medial side of the joint, to supply the upper end of the tibia and the articulation of the knee, anastomosing with the lateral inferior and medial superior genicular arteries. The lateral inferior genicular runs lateralward along the head of the fibula to the front of the knee joint, passing in its course beneath the lateral head of the gastrocnemius, the fibular collateral ligament, and the tendon of the biceps femoris. It ends by dividing into branches which anastomose with the medial inferior and lateral superior genicular arteries, and with the anterior recurrent tibial artery. The anastomosis around the knee joint, around and above the patella, and on the contiguous ends of the femur and tibia, is an intricate network of vessels forming a superficial and a deep plexus. The superficial plexus is situated between the fascia and skin around the patella, and forms 3 well-defined arches, one above the upper border of the patella in the loose connective tissue over the quadriceps femoris. The other 2, below the level of the patella, are situated in the fat behind the ligamentum patellae. The deep plexus, which forms a close network of vessels, lies on the lower end of the femur and upper end of the tibia, around their articular surfaces, and sends numerous offsets into the interior of the joint. The arteries which form this plexus are the two medial and the two lateral genicular branches of the popliteal, the highest genicular, the descending branch of the lateral femoral circumflex, and the anterior recurrent tibial. End of section number 30. Recording by Marianne Coleman Hipkins. www.thisvoiceforyou.com